for You, digging into major changes in the cost of health insurance premiums under the Affordable Care Act.
As we first told you here last night, premiums for some in Indiana could jump by nearly 30%. Take a look. The Indiana Department of Insurance reporting the carrier that most Hoosiers use, Anthem Blue Cross and Blue Shield, will see premiums spike 29%. CareSource Indiana up by 16.1%. Celtic actually down by 5.3%, and MedWise up 11.5%. Those are the 4 remaining carriers in the exchange in Indiana.
Our TV6 State House reporter Katie Hines is working for you live on Monument Circle outside Anthem with what you need to know when signing up for coverage. Katie?
Jason, Erica, 4 remaining carriers here in Indiana compared to 8 this year. That's because half are pulling out of the health insurance marketplace for 2017. That means that tens of thousands of Hoosiers will have to switch carriers, switch issuers in their next plans. The good news, though, Anthem is one of the 4 still available. Sean Ray owns Ablog Dental in Evansville. For the 3rd year in a row, the small business owner is searching for a new insurance plan for him and his wife.
The company's dropped our market, so we went from Humana to IU Health, and now IU Health is pulling out of our market. And we were just informed today that there's only 2 options available, and only 1 qualifies for the marketplace.
At the Raphael Health Center in Indianapolis, Rhonda Peterson is helping patients navigate the options and new premiums ahead of open enrollment.
We're going to look at the financial part to see if they still qualify for a subsidy or tax credit, to look at to keep their premiums at a comparable cost to what they were paying now, or to look at make sure they're doctors, first of all, because they have established a relationship with their physicians, to make sure that their physicians are in their network and they do accept the insurance.
The median patient in the U.S. will see their health insurance premium jump about 16% on the marketplace. But in Indiana, average monthly premiums based on the silver or second cheapest plan for a 27-year-old is projected to drop 3%. That's according to HHS. In addition to calculating out-of-pocket costs and checking doctors, Gregory and Appel consultant Susan Ryder recommends looking at prescription coverage when selecting a plan for 2017.
A lot of the plans have a more reduced formulary list, meaning that employees or consumers won't necessarily have access to the prescription that they may want based on their conversation with the physician.
Back at Raphael, Peterson is reminding her patients to keep in mind that the penalty for opting not to get health insurance is also rising.
This is your insurance. This is your choice.
85% of the people who have insurance through the Affordable Care Act receive some kind of financial help in the way of a subsidy or a tax credit. Open enrollment for next year starts on November 1st. Reporting live downtown, Katie Hines, RTV6.
More details now. The changes in average monthly premiums will vary widely between states in 2017. In Arizona, the premiums are more than doubling. In Illinois, they're projected to rise 43%. And in Arkansas, the premiums are expected to go up 2%. The numbers are from the U.S. Department of Health and Human Services.